Dr. Blakeway. It's lovely to have you here.
Hello, Diana. Thank you for having me.
So let's talk about your line of work as an acupuncturist.
Yes, I'm a practitioner of Chinese medicine, which is a whole system of medicine. So I am an acupuncturist, but we also provide herbs. We do moxa and massage and give lifestyle advice according to the tenets of Chinese medicine. And the reason that that's valued by so many people is that Chinese medicine takes a whole look at people and the sort of patterns of disharmony. We live in that world of relationships. Every cell understands who it is and where it is and what it's supposed to do in a healthy body. Every organ coordinates with other organ systems. And Chinese medicine has a method of diagnosis that has been worked out over thousands of years that helps to explain those relationships in a way that helps us improve them. And a lot of health conditions, particularly chronic health conditions, are actually issues of miscommunication and lack of alignment and synchronization. And so we can be really valuable when it comes to taking a whole look at the body and then acting upon that look.
If you don't mind me asking, endometriosis is a very complex disease. It's very misunderstood. Even the best specialists throughout the world still say they're puzzled by the disease itself. What is your take on it? Is that a miscommunication when you talk about chronic illnesses, because endo is a chronic illness? Do you think there's misfirings happening? I'm just curious about your opinion.
Well, it is a form of miscommunication in so much as your endometrial lining should only be in your endometrius. Yes. And you're right. We don't know exactly why people develop endometriosis. There's lots of theories. And my guess based on experience is it's different for different people. So we know that endometriosis runs in families. So some people have a predisposition towards it. There are theories that it starts with endometrial tissue being in the wrong place. There are obviously theories about the movement of tissue, due to things like doing inversions and things like that. And I suspect it's a bit of everything. And in Chinese medicine, we see it as a whole body disorder, which of course it is. If you've ever suffered from endo or treated people with endo, you'll know that it affects everything, that it isn't just pain in the pelvis, it's pain all the way down the legs, the inside of the legs, for instance. And we see it as an issue of proper circulation. And we divide endometriosis up into the type that is mucousy, which Western medicine also does, and starts to clog up fallopian tubes and things like that, and the type that is more just blood stagnation. And we see it as the body's inability to move tissue that's in the wrong place. If you think about an intelligent, coherent, healthy body, we have tissue that gets in the wrong place the whole time, and your body clears it up. And so there's a sense of overwhelm and an inability to clear that up that is a sort of communication issue. And then, and because one of my specialties is fertility, your body then doesn't recognize this tissue for what it is, thinks it's an invader, and mounts an immune response. In Chinese medicine, we see that response as heat, like overactivity, inflammation. And that gets in the way of getting pregnant. So really for us, it starts with poor circulation and lack of movement, to stagnation of tissue, either blood or mucus or a combination, which then your body reacts to with inflammation, which then causes other problems.
So how does your system help have the body communicate? How does acupuncture help? Does it open up, as you keep referring to, passages? How does it work?
Well, it's interesting, actually. In my last book, which is called Energy Medicine, I looked at the basis for acupuncture. And one of the interesting things, Diana, is that the acupuncture points look to be specialized tissue. And we've known that for a while. They look different on MRI to other points. And when I was writing the book and researching, I realized there was a whole body of academic research out there that showed that when we're embryos, we construct ourselves somewhat electromagnetically. You have to think, if you're a tiny little embryo, you don't have a well-developed cardiovascular system or central nervous system. So communication is done at a cellular level electromagnetically. And what the body does is it creates little nodes that then bud off the next part. So you would have a node on your wrist and it would bud off the arm. And if you think about the intelligence it takes for an embryo to create itself perfectly, it's an extraordinary thing that we all just take for granted.
Yes.
But those little nodes are actually in the same place as the major acupuncture points. So I think we have this electromagnetic tissue that is used to create us and is still there on a sort of slightly more subdued way, but can be used to regulate us. So it sets up pathways of communication in the body, which, as you can imagine, with something like endometriosis, we need to create better communication and flow of what we would call chi, but really what chi is the body's intelligence, the body's ability to behave intelligently and keep coming back to health, which is the part of our body that we take for granted. You know, you have an extra 2 glasses of wine at dinner and your liver sorts it out. You never think about it. It's all happening outside of your mind, mediated through blood chemistry or the nervous system. But acupuncture appears to activate these little areas that have been with us since we were embryos and create a sort of electromagnetic effect that I think runs along the fascia, the fascial planes, and that's how we affect the body. And you know, it's been used for thousands of years for a reason. It's because it works. There's lots of things we used thousands of years ago in medicine that we definitely don't use now.
Right.
And this is one that has increased in popularity outside of Asia and has always been used in Asia as a way of regulating. But what it's doing is prompting the body to be intelligent again. And in endo, that means prompting the body to recognize that this tissue is there and not mount an inflammatory response to it, move blood through it, move circulation through it. And you can actually use thermal imaging to show that acupuncture reduces inflammation. And you can use Doppler ultrasound to show that it improves circulation. 2 important things for people suffering from endo.
That's incredible. I didn't know there were clinical studies to show the effects of that. When I was going through in vitro fertilization, I was told by several doctors, clinicians, that I should try acupuncture in order to improve the outcome of an embryo transfer. And I thought that was surprising, being that you don't usually see a merge of Eastern and Western medicine like that. But that's something that if you Google it, if you're Dr. Google, you can see that acupuncture and IVF tend to be recommended together.
They are, by more and more reproductive endocrinologists at this point. There was a study came out in 2009, which is a long time ago now, but I was in practice because I've done my job a long time. And it took 180 women going through IVF, and half did acupuncture with their IVF and half didn't. And the half that did had a considerably better outcome.
Wow.
And that was published in a major journal for the reproductive endocrinologists, and doctors took note. And in fact, later on, their journal, which is called Fertility and Sterility, the reproductive endocrinologists academic journal, dedicated a whole issue just to acupuncture and looking at it, because it does increase the efficacy of IVF, partly for the circulatory reasons we mentioned before, partly because of the anti-inflammatory function, but also because it seems to balance hormones, which seems a bit of a stretch. How can little needles balance hormones? But if you go back to the idea that we're prompting the body to behave intelligently and in a way that it already knows how to behave, then acupuncture can bring your hormones back into line. And I always tell people our subtlety is in fact our strength, because if you give people hormones, it tends to knock out other parts of the feedback system. They're all in finely tuned feedback. And so this very subtle prompt has a deep effect because it's so balancing and doesn't create further imbalance and side effects.
Mm-hmm. Well, I think this is also with acupuncture, it's a way to put hormones in your body if you don't have to, because one of the major complaints, at least for myself, I have endometriosis. Anytime things have been kind of tampered or messed with any kind of hormone suppressant, birth control pill, I don't have a good response to it. It doesn't help my pain. It doesn't help me. This is my individual story. but it doesn't help me. It seems to throw things out of whack, as you said. So acupuncture is a way of doing it without ingesting hormones, without necessarily throwing other things out of balance. What about people who? Oh, I'm sorry.
You're absolutely right. It is. Although in IVF, we combine it with quite strong fertility drugs. And then we're using the acupuncture to offset the side effects and potentiate the desired effects. So we can use it in lots of different ways.
For people that are saying, "Ooh, acupuncture, those are the needles. I don't want to look like Pinhead. I'm so scared." What do you say to reassure people who might be a little needle phobic?
Well, the first thing to know is that most of our experience of needles comes from shots, from vaccinations and things like that. And those needles are very big. They have to be quite thick because they have to have a hole in the middle, a lumen, for fluid to go through. Our needles are tiny. They're like a hair. You can literally tie them in a knot if you want to. They're very flexible. So this isn't like getting a shot. And it's for the most part pain-free. If you have acupuncture and you experience a sharp stabby sensation, just tell the acupuncturist. That's not, and they'll move the needle a little bit. But there is a kind of dull sensation around the needle that people haven't felt before. And it's not really pain. It's like a dull throb. And that is really the point doing the acupuncture needle doing its job. What happens when they look at it in studies is that you put the needle in, I would put a needle in a patient, we twist it a little, and the connective tissue around the needle becomes like spaghetti winding around a fork. And at that point, as it stretches, it's more electroconductive. So you feel that little stretch, but you don't feel the anything like a vaccination or something like that. It's not sharp and stabby at all. And most people find the needles much less painful than they thought they were going to be in their imagination, that they're actually really straightforward and tiny. And then they get a very nice floaty sensation. One of the side effects of acupuncture is that it induces the body to release endorphins, which is the same, those are your body's painkillers, but they also make you feel a little euphoric. It's the same thing that your body does after exercise. It releases endorphins. So most people lie on the acupuncture table feeling kind of floaty and peaceful. And that outweighs any kind of minor discomfort with the needles going in, I think.
With acupuncture and IVF, how many times do you have to do acupuncture to get the desired outcome? What's the recommendation? And obviously, this is a general idea since people are individualized.
Well, two things. One, there is really interesting research that shows that doing acupuncture in the run-up to IVF is really valuable. There is a study out there by Dr. Lee Hollander that looked at what we call whole systems Chinese medicine, what I was talking about before in some ways, the whole thing, herbs, lifestyle, diet, all of that. And they looked at, I think, over 1,000 couples going through IVF. And they split them into 3 groups: people who did acupuncture just around their IVF embryo transfer, people who did no acupuncture at all, and people who did the whole system of Chinese medicine for 3 months before their IVF. And it was very clear that the people who had 3 months of prep, getting their body into a really good place for IVF, had considerable better outcomes, particularly when it came to live births, which is, of course, what we're aiming for. Less miscarriage rates. And that makes sense instinctively to people, I think. Investing a little bit of time in getting everything as good as you can before you do a very expensive and arduous IVF cycle just makes sense. And then when you're actually doing your IVF cycle, here's what we suggest to our patients at Unova, where I work in New York City. We have them come in twice a week when they're on their follicle stimulating drugs, the drugs that stimulate your ovaries to produce eggs. We time one of those just before retrieval. You'll read on the internet that it has to be like minutes before retrieval. Just ignore that. That, I think, is a misunderstanding of some clinical research where it was just more convenient to do it then. We see people the day before because we don't want to add to their stress. And then we see people around transfer, the day before transfer and the day after their embryo transfer. And then once again the next week in order to what we call a holding treatment, an anti-miscarriage treatment, while therein the patients call it the 2-week wait, the dreaded 2-week wait to find out if it's worked. Yeah,
the hard part. Yeah, that's the hard part.
Yes,
But
it
this
is.
is great that there's this option out there too to assist in a very stressful, like you said, arduous time. So thank you for shedding knowledge on other options that people can try to implement into their IVF journeys.
I think also fertility journeys can be very disempowering. It's very disempowering to try everything and then have it not work. And it's anxiety provoking, as you know, scary, and it takes a lot of your power away. And so a lot of what we do in our clinic is help people get their power back. You know, there are ways you can impact your fertility picture, diet being a great one. And so we give a lot of coaching on how to get yourself into the best reproductive shape.
Yeah, I felt that I was at the top of my health game while I was going through in vitro. I was aware of every single thing that I was ingesting, doing, even stress levels, all the way up into my delivery. I was the healthiest of my life, just because the stakes were so high.
Yes, it creates a sort of focus, which is, you know, you can use to really improve your health situation in general. And lots of fertility patients tell me that they wish they hadn't had to go through this process, but they're healthier because they had to focus on all the little things they were ignoring.
Definitely. Oh, well, I'm so happy you're here and that you were able to let us know what you do and how this can help. And I hope to have you back again soon.
I would love that. Thank you, Diana.
Definitely. We'll see you.